Hi there, Dr. Akshay Sharma here from Cosmeteer. I help women feel confident, look amazing and natural, and have radiant, healthy skin for life. So today's video is about cheek fillers, because you have taken the first step, booked your cheek fillers appointment, and I thought actually it'd be really nice for you to have a video just going over some of the things we will have spoken about, just so you can recall and just feel a bit more reassured with what's going to be happening. So, cheek fillers, as we discussed at your appointment, are generally done with a hyaluronic acid dermal filler. I use Belotero Volume. It's a really lovely soft product that will integrate really well with your skin, and can be used on all sorts of different skin types. So you can rest assured that the material we're using is, from all the research that I've read through my master's program, shows that it's a really lovely product to be using. So what can they do? I think that's the first question we need to ask. So with cheek fillers, what we're aiming to do is generally there's three kind of distinct points that we aim for in the cheeks, and what we want to do is give you that sort of contouring, that cheek definition. Now you might be saying, oh yeah, but I don't want to look over exaggerated, I don't want to look unnatural, and that's absolutely the case. We will not make you look unnatural. The reason we will be doing these cheek fillers in the first instance is really to give you some support, because with age, one of the first bits that will, one of the first parts of your face that will kind of diminish is the bone, the fat, and everything kind of falls down. So I usually describe this as, if the bone is your wooden table frame and the tablecloth is the skin, then the tablecloth is nothing to be supported with if that bone and fat is disintegrating. So what we want to do is we want to treat that level to pull everything back. Now, how much I use will be very much dependent on how much you need, and we will have discussed this at the appointment, and I will go over that again with you when I'm actually doing the treatment. Now, whilst we're doing the treatment, or actually before we do the treatment, I will clean your skin, we'll put some cream on and numb your skin up so you have minimal discomfort, if any, and then once I have done one side of your face, it's normally 3 injections on the top. If we're doing the lower cheek, then it's slightly different. We use a cannula, but I will explain that on your appointment, actual appointment day. So when I am doing it, I will do one side of your face first, let you see the difference, and then see the other face. And what I'm really wanting to do with cheek fillers is the contouring, but also this lid cheek junction that we've got. If I take my glasses off, this junction that we've got in here, that's the bit that most people will be feeling tired with. That usually drops down, and everybody then, when people are looking at you, they're not looking at your eyes, they're looking at this bit. So what we want to do with the fillers is push it up so that people are then guided back up to your eyes. So that is the whole aim, and that is why cheek fillers are really effective at taking away that tired look and giving a very refreshed look very quickly, in fact instantly. The brilliant thing with Belotero Volume is that because it does integrate, you'll find that results will just get better and better with time. So initially you might find that that it feels a little bit odd. I think odd is probably the right word, odd, and then it becomes part of you. So you can rest assured that this material will become a part of you. Nobody will be able to see bumps. You may initially be able to feel some bumps. Not everybody does, but some people do, and you've got to know that this is something I intend to do. I need to put in pillars of support to pull that skin and tissue back, otherwise it wouldn't work for you. So that's what to expect at your appointment. Now, after your appointment, like I said just a few minutes ago, that you may well feel a little bit of feel little bumps on your cheekbones. Do not worry about that. That is intended. Some people don't even feel it actually. Some people do. So don't worry if you feel it. You may feel a little bit tender because at the end of the day we have put something underneath your skin. No one generally has a major problem with this. If you do, you can take some painkillers. Paracetamol is probably your best option. Do not go for ibuprofen because we don't want to increase the risk of bleeding or bruising. And you can sleep normally on it. You can move about. You'll look, when you leave my clinic, you will look better than when you walked in. So you don't have to worry about that. Your skin shouldn't look too red. It really depends. Everyone's skin is quite different, but I will try my best to get your skin to a level where actually no one would know that you've had any treatment. And if they do, it's only because you look so good. So that explains a bit of what to explain after your appointments for cheeks. Now, quite often I'm asked the question, how long will this last? The material is designed to last about 12 to 18 months, but you don't really want to let that material completely disappear and then start all over again. So most people will have a little top up throughout the year, and that way they're staying on top of it the whole time. Now you don't need that. Your cheek filler will be there for at least the 12-18 months. It's just that by adding a little bit, you're getting like an additive, a cumulative effect on it, and it just looks better and better with time. So actually your your skin age is stagnant rather than declining as it would with most people. How much you have, like I said earlier, very much depend on how much you need. And I will have discussed that with you at your consultation appointment. And then if you're at all worried or you're wanting to find out more, you just let me know at your appointment and I can go through how much I'm using and why I'm using that particular amount. So that's it for, I think, cheek fillers. If you're having any other treatments, I will send you videos separately so that we go through it in little chunks. And if you have any questions at all, just get hold of me, rachna@cosmetia.com, and I will email you a response to whatever it is you want to know. So take care, and I look forward to seeing you.